At Tallahassee Memorial Healthcare, we continually seek out areas for improvement and advancement. It's a way of life for us. We must critically evaluate our processes, performance, and quality to ensure we are providing the world-class care that our community deserves. One part of this huge effort is developing and implementing an organizational strategic plan. Our strategic plan defines our goals and areas of focus for the coming years, all aimed at fulfilling our mission and ensuring we are a strong, progressive health system. At TMH, our mission is transforming care, advancing health, and improving lives. Our mission is rooted in our ICARE values of integrity, compassion, accountability, respect, and excellence. As our community continues to grow, we're evolving to meet the needs of the neighbors we serve. To do this, our strategic plan will focus on 7 pillars: quality, safety, and reliability, culture, finance and operations, physician structures, service line growth, strategic partnerships, and academic health center development. Now let me turn it over to our executive leaders for each of these strategic pillars.
Quality is at the core of everything we do at TMH. Providing the best possible care to our patients drives our constant pursuit of excellence. To do that, we must seek out areas for improvement and embrace change. The goal of our first pillar is to make sure we remain focused on quality and patient safety. To accomplish this, we will do the following. First, we're going to set annual goals to improve our quality based on national benchmarks, and it's important that they're national, that we're comparing ourselves to the best around the country. The second is to develop internal and external communication plans to make sure we're talking about quality and patient safety. Number 3, identify and invest in systems to improve our data and analytics. And number 4, leverage and expand our Lean and Six Sigma expertise to support continuous improvement and begin our journey to being a high reliability organization.
When you walk into any public supermarket or visit a Chick-fil-A, you know what to expect: a consistent experience grounded in excellent customer service. It is part of the organization's culture. We want the same intentional, consistent experience for any patient who walks into any TMH facility. Our second strategic pillar is to define our culture. We will focus on the patient and colleague experience and become a regional employer of choice, attracting, retaining, and developing top talent across the organization. Defining our culture is a huge undertaking. To reach this goal, we will define and intentionally ingrain the TMH culture into everything we do. We will promote it to our colleagues and providers and develop accountability structures. We will unify the focus of accountable leadership at all levels, starting with the board of directors and the executive team to the frontline leadership. We will identify and implement effective and progressive communication methods for both internal and external audiences, always tied to our organizational vision and ICARE values. We aspire to be nationally recognized as a top employer health system because of our culture. We will develop a physician culture that supports and aligns with TMH's organizational culture.
For nearly 75 years, TMH has operated as a private, not-for-profit community healthcare system serving Leon and the surrounding counties. As we expand our reach and grow into a much larger healthcare system, we recognize we must make some significant organizational changes to enable this growth to occur. With the future in mind, our third strategic pillar is to increase our nimbleness and project prioritization through long-range planning and transparency, while developing structures to build accountability, develop talent, and establish reasonable spans of control. To turn this pillar into a reality, we will do the following. Number 1, develop an integrated strategic, operational, and financial plan. Number 2, develop a system-oriented organizational structure to position us for future increased scale, size, and scope of operations. Number 3, enhance our financial and operational technology, innovation, and automation to improve our processes. And number 4, prioritize leadership development and engage in succession planning for key leaders throughout the organization.
Part of our journey as an organization is to ensure we have the highest quality providers delivering the highest quality evidence-based care. The goal of our fourth pillar is to build and sustain physician structures with the medical community in the greater Tallahassee region. We will work to provide an environment that supports the delivery of high quality, safe, compassionate care and enable us to recruit top clinical talent. We will do this in 4 ways. We will increase alignment between TMH and key independent practices. We will enhance physician leadership and medical staff engagement and culture. We will implement medical staff development and succession planning, and we will address at-risk specialty groups to foster continuity of services.
At TMH, we're a leader in the Big Bend region for cancer care. We have one of the most advanced heart and vascular programs in the Southeast, and we're home to North Florida's only comprehensive stroke center and neonatal intensive care unit. And this is only the beginning. Our fifth goal is to be a destination center for high-quality care, with key service lines to attract and appropriately manage patient volumes from across the region, including Georgia and Alabama. To achieve service line growth, we will 1. Improve access, service line quality, and consumer satisfaction. 2. We're going to establish centers of excellence for higher acuity specialty care. 3. Enhance participation in digital and telehealth initiatives to expand our reach and grow expertise. 4th, utilize consumer-focused communication strategies.
We know we cannot be all things to all people. We must create partnerships to grow. Our sixth pillar is focused on strategic partnerships. As we continue to expand our services at TMH and grow our footprint through key communities, we will also establish new payer and provider partnerships. To accomplish this goal, we will build local partnerships that extend TMH's ability to influence and engage in the continuum of patient care. We will explore value-based care models with key local payers and providers. We will continue to build alignment and collaboration with surrounding rural hospitals. We will also develop programs to increase alignment with suburban facilities. And we will build a development plan for our new healthcare campus in Panama City.
Our seventh and final pillar of the strategic plan is focused on becoming an academic health center in partnership with the Florida State University. We are thrilled to partner with Florida State University and establish an academic health center model to aid in attracting clinical talent to the region, provide increased research capabilities, and build a reputation of both organizations.
Becoming an academic health center is an extraordinary effort that will benefit our patients far beyond the Tallahassee region. The research conducted through this endeavor will propel innovation and directly impact the future of our community and healthcare as we know it. To bring this academic health center to life, we will, number 1, create a joint governance structure with FSU and communicate a clear message of the partnership. Number 2, assess and consolidate research capabilities and resources, identify and grow high-impact investigation, and prioritize selective investments and initiatives to improve research collaboration. Number 3, strengthen and restructure existing education programs to better align with academic partnership objectives, enhance the student and clinical faculty environment, and grow new programs. Number 4, develop a sustainable academic ethos among clinical staff to enhance clinical capabilities with a focus on increased access, superb outcomes, and improved population health. Number 5, optimize health measures for the communities we serve while engaging community and stakeholder groups to support the academic health center's vision.
The strategic plan outlines a clear vision for our future. Working together, we can further enhance the breadth and depth of care we offer throughout our region in order to provide patients and families the seamless and consistent quality experience they deserve. I look forward to working with you to seeing this vision through. Here's to the future, delivering world-class healthcare and to being your hospital for life.